You've probably heard an apple a day keeps the doctor away. While it's an oversimplification, the idea rings true. In tonight's edition of Feel Great Today, we'll hear how small, healthy habits over time can make a big difference.
Feel Great Today with Jessica Jukic.
I think that diet plays a role in just about every aspect of your well-being, and I think that it needs to have a lot more attention paid to it.
Dr. Joelle Wendland is a gynecologist at Aspirus Woodruff Clinic. She says focusing on mindful eating, portion control, and steering clear of fad diets is a few ways to improve your overall health and sustain long-term weight loss.
When you look at the different diet plans and follow people over a time, they all pretty much end up back at the same place. Those diets that I'm referring to are like the Atkins diet, low carb, high fat, a number of different diets along those lines. They're also not associated with any other great health benefits.
She says another problem with restrictive diets is you can become deficient in certain vitamins and minerals.
For example, when patients become vegan or vegetarian, they actually can become deficient in both iron and vitamin B12 and not be aware that those often need to be supplemented.
She says small substitutions can go a long way, such as swapping unhealthy fats for healthier ones.
The more we can eliminate the saturated fats and instead replace them with our unsaturated fats, things like our healthy fats, such as extra virgin olive oil, in addition to some other oils, that is tremendously helpful in reducing our risks for cardiovascular disease and other medical problems.
Dr. Wendland says if you're looking for a healthy plan for long-term success, the Mediterranean diet is one of the best. It limits red meat and focuses on vegetables, beans, nuts, whole grains, and fruit.
Whereas with the Mediterranean diet, we can see a reduction in blood sugar, we can see improvement in the cholesterol profile, we can see a reduction in blood pressure.
The American Heart Association says nearly 130 million adults in the U.S. have some form of heart disease. Coronary artery disease is the leading cause of death worldwide. In tonight's Feel Great Today, we'll hear what causes coronary artery disease and how to reduce your risk.
Feel Great Today with Jessica Jukic.
Coronary artery disease is the development of plaque in the coronary artery.
Dr. Michael Zevitz is a cardiologist at Aspirus Cardiology Rhinelander. Coronary artery disease is the buildup of plaques in arteries inside the heart that can begin at a young age.
And it takes many years to decades to develop up to a point where once the plaque starts to narrow a vessel more than 40 or 50 or 60 or 70%, now that's when heart disease complications start to develop.
Coronary artery disease is the silent killer because you can have it for years and have no symptoms until it's too late.
They either have a heart attack or the development of heart failure, or they start having episodes of chest pain or shortness of breath. And people that have the development of chest pain and shortness of breath, that occurs when people develop plaques where the narrowing of their coronary arteries exceeds 70%.
There are many risk factors that play a role in developing coronary artery disease, including smoking, drinking alcohol, genetics, and pre-existing conditions like high blood pressure.
Autoimmune disorders increase the risk of coronary artery disease, and some of them more than others. People that have lupus have a much higher risk of developing coronary artery disease. People that have peripheral artery disease, people that have vascular disease in their legs, or people that have had strokes.
The best ways to lower your risk of coronary artery disease is by eating healthy, exercising, and getting plenty of sleep. Dr. Zevitz says people should be proactive and not wait until the onset of symptoms.
Just because people feel well doesn't mean that you shouldn't pay attention to your health. Don't wait until your symptoms begin. That's the reason why we recommend going to a doctor and getting regular checkups.
There are several lines of defense against germs in the body. One of those is adenoids and tonsils. In tonight's edition of Feel Great Today, we'll explain how they protect your body from infections.
Feel Great Today with Jessica Jukic.
Adenoids and tonsils are part of the lymphoreticular system, which is the part of your body that helps your immune system fight infection.
Dr. Greg White is an ear, nose, and throat doctor at Aspirus Rhinelander. Adenoids and tonsils work together to identify, trap, and fight bacteria and viruses.
We have a lot of fluids that circulate through our body, and it samples that for signs of things that shouldn't be there, and it sends out signals to recruit other cells and sends out other chemicals to help fight infections that it detects.
Sometimes tonsils and adenoids can become infected, causing a variety of symptoms.
Adenoids will cause nasal congestion and drainage, and sometimes mucus collecting in the back of the throat. Tonsils will cause a really bad sore throat, some difficulty swallowing, pain when you swallow, sometimes obstruction of your throat.
Dr. White says he will remove tonsils and adenoids if they become permanently inflamed or if you have an abscess or several infections a year for several years.
3 infections a year for 3 years, 5 infections a year for 2 years in a row, or 7 infections in 1 year. If people are really allergic to a lot of different classes of antibiotics and it's more difficult to treat an infection, we might be more apt to take the tonsils out then.
He says tonsil and adenoid problems are more common in children and teens than in adults. Enlarged tonsils can also cause issues when eating or sleeping.
In kids, taking out tonsils and adenoids for snoring and disruptive or disordered sleep is successful about 85% of the time. So it's kind of one of the first line things you do for children.